My name is Liang Wang. I'm a professor and a group leader currently working at the Department of Laboratory Medicine, Guangdong Provincial People's Hospital, China. I'm also affiliated with the University of Western Australia and the University of Queensland as an adjunct research fellow and with IntechOpen University as an adjunct professor. I'm glad to have this opportunity to introduce to you our group and also talk about our new book about H. pylori diagnosis and eradication. Our group mainly focuses on bacterial metabolism and physiology, its evolution, transmission, and pathogenicity, and also the rapid diagnosis of bacterial pathogens to better control and prevent its transmission and the infection. Meanwhile, it's a great pleasure for me to share with you our latest book towards the eradication of Helicobacter pylori infection, rapid diagnosis, and precision treatment, for which I served as an academic editor. The other two editors of the book are Helicobacter pylori expert Professor Alfred Chin Yen Tay and the 2005 Nobel Prize Laureate Professor Barry J. Marshall from the University of Western Australia. The book serves as a comprehensive guide to navigating through the complexities of diagnosing and treating H. pylori infection. The first part of this book delves into the various diagnostic modalities available for identifying H. pylori infection. The second part of this book shifts the focus towards treating H. pylori infection, addressing the challenges posed by antibiotic resistance and the role of stewardship in optimizing treatment outcomes. We hope that you will enjoy reading the book. Finally, we are honored to extend our gratitude to all the esteemed authors who contributed their invaluable insights and expertise to this book. Additionally, we extend our sincere thanks to the IntechOpen, the world's leading publisher of open access books, for their commitment to advancing scientific knowledge and fostering collaboration within the academic community.
Hi, I'm Dr. Alfred Tay. I've been researching on Helicobacter for over the past 10 years. My interest is in the evolution, epidemiology, diagnosis, and treatment of Helicobacter pylori. Helicobacter infection is a chronic disease. Therefore, it's easy to give people an illusion that it is not important. However, I have to remind you that gastric cancer is still the number 5 killer in the world, and Helicobacter is strongly associated with gastric cancer. We always use Australia as the example. Once you get rid of Helicobacter, you get rid of gastric cancer. So we have done many studies on Helicobacter pylori over the past 40 years. However, there are still many things we don't understand. For example, how Helicobacter causes cancer and how it's spread among people. So I hope this book will gather enough information to encourage colleagues in continued research in Helicobacter pylori and give confidence to doctors in treating their patients.
Good morning, I'm Barry Marshall, Clinical Professor of Microbiology and Brand Ambassador at the University of Western Australia in Perth. And I'd like to talk briefly about this new book of ours. You know, this year is the 40th anniversary, 2024, of the first good publication of Helicobacter pylori in the Lancet. And it's also the anniversary of me drinking the Helicobacter pylori to prove Koch's postulates, which proved actually that Helicobacter causes gastritis. So it's been a long journey, but looking back on it, there are a number of important milestones. So in the beginning, it was just a hypothesis and people became interested in the cause of gastritis, and then we had some difficulty because so many people had Helicobacter and didn't have any symptoms. But by focusing on the ulcer patients, we quickly brought benefit to millions of people. So the problem initially was that we didn't have a very easy diagnosis or treatment. So these things were tackled in the first, say, 15 years. And by 1990, we started to see double-blind prospective trials showing that eradication of H. pylori was important for the prevention of peptic ulcer disease and gastric diseases. And remember, in the 1990s, that's the first time the World Health Organization gave Helicobacter pylori a classification of being a cause of cancer. So that perked up everybody's interest. But again, treatments in the 90s were very complicated. Actually, they still are in some people. But the thing that happened in the 90s was the advent of the proton pump blockers. And so we knew that you must eradicate the acid before you can eradicate the H. pylori. And so by the year 2000, the scene changed. And we saw that very easy, high cure rate treatments were available. Also, breath tests were available, so family doctors and non-gastroenterologists could easily diagnose and treat Helicobacter pylori. So then in the Western world, quickly we saw a big transition with millions of people being treated. And now everybody else has embraced those technologies. And, you know, I visit China quite often because there's still about 350,000 people per year who die from stomach cancer in China, which is all probably caused by Helicobacter pylori. So the future is to make these diagnostic tests easily available. And the new thing is to give people precision medicine, which means actually get information about their individual Helicobacter infection so that we can predict which antibiotics are going to be most useful. Then we can have perhaps shorter courses of antibiotic treatment with high cure rates and low side effects, just as we did in the beginning 20 years ago. So I'm excited to say that there are a few things that are happening. One of them is that we've started doing string tests on people with Helicobacter pylori. So the algorithm goes, if you fail treatment according to your breath test, well then you could have a string test, get the antibiotic sensitivities of the Helicobacter organism in your stomach by qPCR, but also by culture in a good lab, and then be prescribed the treatment which is really going to work. And you know, so many people have a resistant organism, resistant to metronidazole, clarithromycin, and levofloxacin, for example. So we don't always have to navigate away from those antibiotics because they are very effective. But in a lot of people, we would like to know the exact sensitivity pattern of the organism so we can treat the H. pylori with confidence. Now, as soon as you have a good treatment that doctors can confidently use, they really like to treat H. pylori because many people have had that bacteria all their life and have had suffering from chronic symptoms. And so it's such a reward for the doctor to be able to cure somebody just with a course of antibiotics. So I encourage everybody to keep looking for the latest advances in Helicobacter pylori treatment. And you know, there's even stronger acid blockers on the horizon for a lot of people called PCABs, potassium competitive acid blockers. It's hard to remember that name. But the PCABs are a little stronger than the PPIs, and we've seen pretty good cure rates with PCABs, even just with amoxicillin in longer courses for resistant cases. So it's an exciting time, and I'm glad to be involved with it, and I hope you get lots more information and a good overview from the chapters in this book.